Well, the situation right now in Goma, but as well in the northern province, on the North Kivu province, it's right now we're in a kind of an uncertainty. In the last weeks and in the last 10 days, it's true that after the fighting in central Goma, we saw a high number of trauma cases that were overflowing the hospitals. And right now we are in a moment that we're trying to see, especially how this population that has been settling around Goma is going to be reacting. We're having misinformation about, or mismatching information about this displaced population starting to go back to their villages. And we're pretty much concerned of where they're going to be heading to and which is going to be the services provided to them and on their arrival places.
So right now, there are many issues to tackle at once. What would you say are the immediate urgencies right now?
Well, right now, what we are assessing is as well the water situation in town. We know that town has been without water, especially on the peak of the fight. So we're trying to monitor cholera and how these cholera cases may be popping up. We're trying to assess the capacity of the health facilities to receive the incoming patients, especially the ones that they have not been going to the facilities during the peak of the fight. And what we are worried the most is the future, or where is going to be all this displaced population that has been around Goma. What is going to be the future of them? Are they going to continue being in the camps so we would be able to provide them the support there? Are they going to be moving somewhere else? And which is going to be the conditions or the places they're going to be settling? So right now, as I said, we are in a moment of a huge uncertainty that it's not facilitating our task to be able to scale up and to support this very vulnerable population.
So given the insecurity in some areas that are not reachable, how is MSF adapting its strategy to ensure that those who are in critical positions, the critical cases, are reached?
Mm-hmm. Well, right now, MSF, and especially after the peak of the fight and when we saw the security guarantees were granted, we reached again very quickly the camps where we have been already operating even before the fighting was getting close to Goma, and trying to reopen not only the clinics and the activities that we had, but as well thinking what else we could do. But as I repeat, right now, the situation in the camps is not very clear. We have seen a lot of population movements outside the camps that we don't have a clear indication or idea where they're going to be heading to. So for us, it's very complex to see where we would be needed and where we would be needed to scale up. Obviously, we are getting ready. We're trying to identify possible scenarios and seeing the capacity that we will have already in the ground to be able to support this population, especially with acute health needs.
And before we wrap quickly, Natalia, what is your message?
Well, right now, it's the message is that let's try to see how these things is going to be concluded. MSF is going to be ready to support, but as well, as I said, right now we are a little bit in a uncertainty mode and wait and see as the rest of the population here.